Thank you all for being here today on this important conversation. As you can tell by the scope of the people who are here today behind me, every facet of our city enterprise is engaged and is working during this very trying moment. Today, our country faces an ongoing threat from COVID-19, one that could last months and impact all of us. City halls in every state are confronting this threat and grappling with a new era of uncertainty. With such uncertainty comes anxiety, which I know we have felt at varying levels. We hear about what the rest of the country and what the rest of the world is experiencing, and we want to help. That's who we are as a people. In Minneapolis, it's what makes us, us. Those ideals, those values we hold steadfast will be all the more important in months ahead. Above all, we need compassion. Compassion for those who are sick, giving them support and space to get healthy. We need compassion for those who are healthy, giving them the support they need to support those who are ill. There is temptation to flip a switch, completely shut down, and just ride it out for the next 30 to 60 days. But public health research and quality emergency operations planning tells us that it is best not to take dramatic action without being based on solid rationale. It is better to gradually move up and eventually down a sliding scale or spectrum of actions. In some cases, it may take a few hours to move to the next level of actions. In other cases, it takes days. Circumstances may require anything from clear recommendations to mandates. The city cannot function without our first responders, without clean water and safe streets. To that end, let me reassure the public that our core functions at the city will continue without interruption. While the Minnesota Department of Health is leading the statewide response to COVID-19, city staff are continuing to work around the clock with state and county partners to enhance readiness efforts. Earlier today, I met with our respective department heads to provide further guidance and to discuss contingency plans. We are taking concrete steps to ensure we continue delivering city services with excellence and with compassion. We're shoring up protections against cyber attacks and moving forward with staffing contingency plans for first responders and 911 dispatchers. We are testing our IT and managerial infrastructure so we are prepared if at some point city staff need to work remotely. We're also working internally with multi-jurisdictional partners on pooling both resources and staff. And we are continuing to engage service providers across our city to enhance mitigation efforts and support our most vulnerable population, including seniors, public housing residents, and those who are experiencing homelessness. For the next 30 days, we have guaranteed our city's clean water will continue to run for all residents, regardless of their ability to pay. The cold weather rule, which prohibits our utility companies from shutting off heat, is in effect through April 15th. I'll be reaching out to mortgage lenders and landlords directly, requesting grace in this trying time. We need to do everything in our power to promote social distancing and ultimately the health and well-being of the people of Minneapolis. We've heard continued calls from small businesses concerned first and foremost for their employees and also their bottom lines. We're presently working with our small business team and community partners to determine what support is possible at the city level. It's also critical that people who work in Minneapolis understand that they are covered by our safe and sick time policies. More information on those protections is available at sicktimeinfo.minneapolismn.gov. We will see the coronavirus in our city. It is likely that many will fall ill. COVID-19 will inevitably bring change to Americans' daily lives. But one thing cannot change, will not change. The city of Minneapolis has to do its job. I'm inspired every day by the incredible work of our staff and their collective and unflinching recognition that the freedom of our city is not up for debate, that our core city services must and will remain intact. To provide these supports and others, I've asked our interim city coordinator, Mark Ruff, to coordinate basic preparations for Minneapolis, and he will speak shortly. But first, I'll turn it over to a partner and the president of our city council, Lisa Bender.
We'll do that. Let's demonstrate
That's right.
our elbow bumps. I'm Lisa Bender. I'm the president of the Minneapolis City Council. I'm very glad to be here today with Mayor Frey. I want to thank you, Mayor, for your leadership and your partnership with the City Council. We had a City Council meeting this morning and we're able to have a briefing from Mr. Ruff and Commissioner Musicant, who will be speaking shortly. We also have scheduled meetings next week for more in-depth briefings of council committees. On Monday, the Public Health Committee will have a more in-depth briefing on public health questions, sharing and answering questions largely on what we've been hearing from the Minnesota Department of Health with their announcement that just came out today and ongoing updates that we're hearing from our partners at the state. As the mayor said, local governments, including the city of Minneapolis, are really working in partnership and constant communication with and in coordination with the Minnesota Department of Health, which is really leading our community through the health guidelines that we will all be following. Then on Wednesday, the Public Safety Committee will have a briefing related to our emergency response capacity. I'm pleased to share that our fire department, our police department, our 911, and our 311 operations have many contingency plans in place. We've dealt with emergencies before and we are well prepared. We know that we continue to learn about this particular situation, but our city departments, including our first responders and emergency responders, are well prepared for guiding our community and supporting our community through emergencies. As city leaders, we want to ensure that the people who work for our city, who are coming to work to keep that water on, to respond to emergencies, to be that front line of support, are well protected. And so while we continue to follow Minneapolis Department of Health guidelines, we are working to accommodate and support our employees. Everything from reviewing our leave policies to providing support to our employees. I was very glad at the briefing today that Fire Chief Friedel raised the issue of mental health services, which are available to our employees. I really want to encourage City of Minneapolis employees to speak with your supervisors, to take your leave if you are feeling ill, if you need to care for an ill family member. We have those policies in place. To speak to your supervisor if you need extra accommodations, and to speak to your friends, to your family, and to your supervisors about the feelings and emotions that this is bringing up. Because as the mayor said, this is raising issues of anxiety, of concern in our community, and we need to be compassionate and embrace and support each other wherever we are at. And that is what we are set up to do here in the city of Minneapolis, to support all of our employees as they stand up and help support our community. We were able to pass a staff direction this morning that spoke to some of those external supports. We have champions on the Minneapolis City Council for so many areas of community support and deep relationships in our community. Everything from communicating with folks who don't speak English or who may not have internet access, to share information with our vulnerable communities. We have folks talking with the Minneapolis Public Housing Authority about the people who are living in our public housing in Minneapolis. We have staff working on contingency plans for folks who may be experiencing homelessness or who need extra support. We're talking with partners at every level of government to look at support for people facing eviction, hopefully stopping evictions in Minneapolis and hopefully across the state, as we don't know the full impact, of the economic impacts of this, but we're readying ourselves to really protect those who are most vulnerable, learning from other cities that have been impacted so far, how they're working to support their small businesses, their artists, their musicians, the folks whose livelihoods rely on large gatherings. We need to come together as a community and support each other, support our local businesses and our creative sector. So we're looking at ways that we as a city can lead that, and I know that will include a lot of support from community institutions and all of us together. So those are some of the things that we are talking about, but I really want to emphasize that while we continue to follow practical guidelines and use evidence-based thinking to make decisions, we are also leading with compassion and really focusing resources on the folks who are most vulnerable. The water shut-off decision today is one example. We're working with our utilities, with our cable companies to ensure that folks have access to needed services, no matter their ability to pay, as we look forward to some potential economic impacts from this. So we're so grateful to all of our department heads, all of the staff who've really stepped up to be creative, to be proactive, to come prepared, and to help us all weather this together. I'll turn it over now to Mark Ruff, our interim city coordinator, who's been leading those efforts among our staff to prepare us moving forward.
Thank you, Council President. I am Mark Ruff, the interim city coordinator. During a time of crisis, I think any organization, any region's, both strengths and weaknesses are magnified. What I am heartened by and buoyed by and motivated by every day is the great amount of strength that you have in this room today and among the department heads and the elected officials and our institutional partners, whether it be Hennepin County, the University of Minnesota, the state of Minnesota, the school district. We are in constant communication with each other at a number of levels. We have very robust communication staff. We have a very experienced emergency operations staff, and we take that information, we share it, and we adapt, and not just on a daily basis, but on an hourly basis. I think our residents and our businesses can be assured that the quality and dedication of our individual employees, I think, is unsurpassed, and that we will be here for them, that we are working not only to care for them and their families, but as our primary job description to care for those out in the community. I also want to say that as much as possible, we will continue the business of the city. We will still undertake procurement processes of awarding contracts, of keeping the economy moving forward in a safe fashion, but in a way that also moves the priorities laid out by our mayor and city council forward. And we will, in some ways, as staff, find this as an opportunity and a challenge to engage people in a way that's not traditional, so that if we can't gather together, what are there other ways that we can still receive input on our many important endeavors, whether it be the Transportation Action Plan or the planning of the former Kmart site. So I can assure you that those thoughts are being discussed on a regular basis, and I have confidence in our staff as a whole.
Thank you, Mr. Ruff and Council President. Next, the Health Department has led in a significant way in our city, and I'll turn it over to Commissioner Musicant to discuss the work her department is leading.
Thank you. Thank you, Mayor, and I'm just so grateful really for the alignment we have in the city between Health Department and all the other departments and our elected leaders as we face this unusual challenge. It's a novel virus, and so we have not seen it before. We have some sense of how it behaves because of how it's been in other countries, but it is an evolving situation. We set up a system of oversight of the work related to the virus more than a couple weeks ago and have been working hand in glove with others in the city. We have also been coordinating with the healthcare sector that is busy coordinating amongst itself, leaning forward into projections about how their systems might be stressed. We're working with other public health agencies, including Hennepin counties, and we are taking the lead from the Minnesota Department of Health and the CDC. We are meeting in preparation for the next phases with the healthcare safety net to make sure that community clinics, Home care providers and others have the equipment that they need and the planning for their own continuity of operations. We are assessing the use of personal protective equipment like masks. I'm sure you've heard that masks are not easy to reorder, and so we're looking at the stock we have and trying to make sure that it's allocated to the places it most needs to go and that we're using it in a way so that it has its longest shelf life. We are consulting and being consulted by Minneapolis residents and organizations who are wondering how should they respond, what can they do. And the notion of innovation is really important within the context of the guidelines. So we have guidelines about how to proceed, but then there are choices within that. How can venues continue to follow the guidelines that we just heard from the State Health Department about the number of people that should be gathered together, but also if you're a smaller gathering, how can you create more space between people so there's more of a sense of safety and not passing this virus from one person to another. And we are planning and supporting the work of organizations like the Minneapolis Public Schools as they also grapple with this changing environment. So I have said a couple of times already that this is an uncertain environment. And what can people do with the stress that comes with uncertainty? We would all like clear answers, the same answers, something steady from one day to the next. And hopefully the steadiness comes from our commitment to working on this. But the answers are not always as steady. So there is stress for all of us. And I think we need to acknowledge that. We need to think about how we're going to cope with that. Each individual probably has ways that they de-stress. Going for a walk, taking some deep breaths. I know I've had to remind myself about the deep breaths lately for myself, and then they work. Staying home from work or school if you're sick, of course, is another action people can take. But taking care of one's neighbors is also something people can do. Take note of people who are now socially isolated because they can't go to some venue where they usually connected with people, and connect with them on the phone and see if they have enough food and other supplies so they can stay home. So as we proceed, we are guided by science, the State Health Department, and then the creativity of our community in responding to this changing environment. And as the mayor suggested, this is going to be a ramping up and a ramping back down. And so we want to be ready for all the stages that are ahead of us. Thank you.